Today on the Cameron Journal podcast, we are joined by Melissa Winger, who is, she's written a book called Who Cares about all the ways in which the medical care system has failed her family and fails others with complex chronic diseases, sort of thing. And this will be an interesting journey. We've talked a lot about healthcare over the last several episodes with Guy Morris and Dr. James Augsbury and others who've talked about the ins and outs of trying to get medical care in this country. And the subject is always near and dear to my heart because I have a chronic thing. I have asthma, and I can tell you how all the ways in which they fail, that sort of thing. And then also as a neurodivergent person, we aren't even thought of 90% of the time. And then also my so longtime listeners to the show will know my ex-girlfriend had a series of chronic issues and watching her deal with chronic pain. And when we met in 2019, she had just gotten into that life and she had literally going to doctors was a part-time job. I actually tracked it. She spent 23 hours a week. That's a part-time job just coming and going from doctors. And we were blessed at that time that she didn't have to work. I was able to cover all of our bills and everything, which included a lot of being very careful with gas and shopping at Aldi, but we managed. And this is some of the struggles, even in an early relationship, it's just so obviously this is just such a huge thing and the medical system doesn't always work the way that we would want it to. So this has been a hot topic of conversation. I've told some of these stories before, so longtime listeners will hear a lot of the same old from me, but we'll be hearing a whole new set of drama from Melissa, who's the author of Who Cares. So welcome to the Cameron Journal podcast.
Thank you so much for having me. It's been an honor to be on your platform. Thank you.
Yes, thank you. Well, why don't we start right from the beginning? We were in doing our pre-production talk, and you were right about to tell me all about your situation. So why don't we talk about yourself, your book, and what your family's been through, and why you were inspired to write it?
Yeah, of course. So my son, who's now 29 years old, was born with a rare chromosome disorder. So rare, there's no name for it. He's missing half of his fourth chromosome. And I had him at the age of 18. And what sort of the chromosome disorder is that he has problems with every single organ system. So nothing was formed properly. And even because of his rare diagnosis, we didn't have an outlook of this is the disorder and this is what is going to happen because they didn't know because it is that incredibly rare. So even as of 3 years ago, we were still getting diagnosis of things he was born with. So and developmentally, he's more of like a toddler age. I always say kind of a toddler age, but with 29 years experience. And also with severe autism, so he's non-verbal. And I had to write this book because I wanted it from the patient perspective of the entire journey, not one hospitalization, not one illness. That there's a lot of books written from the patient perspective about that, but I wanted something from how I got prenatal care in the US all the way through long-term care, because my son is now in a group home. And that is the entire experience. And so the book looks at his personal journey through different parts of the health system. And then I went into a lot of research and data on why the US healthcare system is like that.
Excellent. Mm-hmm. That's a very difficult thing. And you were so young. That had to have been overwhelming. Mm-hmm. Like, I cannot imagine trying to manage, new baby, that's stressful enough. New baby with a lot of problems, and we don't have names for any of that, sort of thing. That is got to be impossibly overwhelming.
Yeah, it was somewhat of a little bit of a nightmare, but the nightmare didn't come from like my son having him and being concerned about him. It was the harsh conversations coming in from doctors and the way a diagnosis was given was he has this incredibly rare chromosome disorder. This was 4 months. He's 4 months old. And We're in a doctor's office. So he's not in a hospital on life support. He's in a doctor's office. And I was told that his condition's not compatible with life. And just don't be a hero and let him go. You're young. You can have more kids. And it was like, what just happened? I mean, it was just like a 2-sentence thing. Yeah. It's awful. And we still give diagnoses that way. We still say, never, never, never. Like, your child will never hold his head up. Your child will never crawl, walk. he can do all of those things now. But I was told in the beginning, no, no, no. And we still do that to this day. We take away a lot of hope. And not saying that everyone does this, but a lot of hope is taken away in our medical system.
Yeah, and let's kind of, I mean, walk through that. What was it like, especially as,
Mhm.
a young mother, those first several years kind of getting used to this?
Mhm.
Um, what was like, what did it feel like to feel like they'd sort of already given up before you'd even gotten a chance to start?
Yeah. That was the main issue, is that I had him and I was sent home with him as a typical baby. Like they didn't
Right.
even really give him a thorough examination. So I had no clue there was anything wrong with my son.
As my Nana said, they would deliver babies in the parking garage if they would let them.
Yeah.
Yeah.
He couldn't eat. He had trouble swallowing. So they taught me how to stick this tiny tube down his throat and said, okay, if you can do that, go home. So I
Yeah.
learned how to do that. And then they were like, he'll just figure things out. He's just acting like a premature baby, even though he was full term. And I kept bringing him to the emergency rooms, and because he would turn blue all the time, I couldn't get him to wake up. He would never cry. I'd go to the emergency room and they kept telling me, well, that I didn't know how to feed him, or I didn't know things because I was young. And I was like, whatever. If it's me, help me. Finally, they gave me a teen mom mentor lady.
Mhm.
She came to my house. She took one look at my son and was like, he looks so sick. And I was like, I know, I keep bringing him in. They kept telling me that I'm not feeding him right and that I'm not doing this. And she brought me and my son to the emergency room and basically laid down the law and said, somebody, please, there's something wrong and it isn't the mother. And that's when he was diagnosed. His intestines were malrotated and his heart, they noticed a heart condition, but that was the first time, 4 months old, that we had a thorough exam.
That had to have been a long 4 months, I think is
I
what
don't
I'm
know how he
hearing.
lived. I don't know how he survived with me. And his dad is very involved too. And his dad's 18. We didn't have a lot of family support. So dad worked like 3 jobs, and it was, no, I don't know how my child survived with everything in his body being wrong.
Yeah.
I don't know. He's a survivor.
Clearly, clearly, very, 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 very much so, very much so.
Mhm.
So now let's move forward a little bit. So you finally get some help. Thank God for this advocate woman.
Right.
That's why patient advocates are so important. You finally get some help, and then when they finally did get into motion,
Mhm.
then kind of what happens and how did you start to navigate those
Mhm.
early days, and then I think probably coming to realize, yikes, not probably getting the help I
Yeah.
really need.
Yeah, there was a lot of that. It was getting that first horrible diagnosis of he's not going to make it, and it was so bizarre because I picked up my baby in a car seat and I'm like, what now? What do we do now? And but what was happening is that since we didn't know everything, my son would be diagnosed with something, he would have a surgical repair, and he would recover. And my child recovered like quickly. And then we would diagnose something else, diagnose something else. This was our entire life up until even like 3 years ago when he was diagnosed with something else. But we had to learn quickly about not just being in a clinic or a hospital, because my son was on equipment at some points. So now you got to navigate home care. Now you got to navigate how to get medical equipment. And now you got to navigate the whole pharmaceutical industry. And so it's like this entire journey. And when things went wrong, not to blame my parents, but my mother always told me the doctor's always right. You would never question the medical providers. Like, you have barely a high school education. Who are you to, criticize what they're doing or what they say? So I had to get over that. That took many years to get over that. But it was the mistakes that were happening that would cause my son extreme pain, that like missing pain medication right after surgery. Um, it was medical, like he had a drainage tube that was left in his kidney after surgery and had required a very extensive surgery to remove that part that was left in. And I thought I was losing my mind. I was like, do we have the worst luck ever? And then I started looking at the fact that this happens everywhere. And not only back in 1996 and the year he was born, but it's still happening now. He just had a world renowned hospital last year. Major medical mistake during a procedure that left massive internal bleeding. So it's still happening. And it's not the place, it's not the person, it's the entire system.
Yeah, it's a difficult it's a difficult
Mm-hmm.
it's a very difficult thing. I've recently been educated on the other side of this.
Yeah. Yeah.
I'm affiliated with Something Other Publishing, where I'm director of publications and anthologies, and in March we released a book from Dr. James Augsbury on a medical malpractice case he went through as a doctor in the late
Mm-hmm.
80s, early 90s. And it was kind of one of those, and a lot of the a lot of the it's called About Not Losing. I actually wanted to retitle it to Standard of Care because that
Mm-hmm.
figures quite widely in the case. And unfortunately, it was kind of it was a comedy of errors in terms
Mm-hmm.
of this woman went into she was having sinus issues. They were scraping the inside of her sinuses. They
Mm-hmm.
pierced the sinus and the brain barrier, and the brain fluid came out.
Mm-hmm.
They came to Denver. They were in Wyoming. They went to Denver to get this fixed.
Mm-hmm.
Dr. Augsbury tries to unsuccessfully fix it twice, and unfortunately, it leads to severe brain damage, and she lived the rest of her life at home in family care, basically a vegetable, and I believe she died in 2003. And
Mm-hmm.
it's a very difficult thing. You know,
Mm-hmm.
it basically the case all turned on, was everything that could be done correctly, yes or no, and then what's the dollar amount, you know, based upon that sort of thing. They eventually settled because they gotten money elsewhere for the rest of her care for her life and all this sort of thing. But having looked at it from kind of that perspective, and the kind of you know, fire doctors come under, this is a very interesting
Mm-hmm.
conversation. Because there's definitely, you know, there's sometimes operations fail and don't work out the way they're supposed to. Every operation
Mm-hmm.
has a certain failure rate. It's well documented. But then when you start leaving sponges in people, you hear those stories, you know,
Mm-hmm.
or in your case, a tube gets left behind. You're kind of
Right.
like, well, things have gone wrong here. Like, you
Yeah.
know,
Mm-hmm.
like, you know, um,
Mm-hmm.
and that makes things quite difficult
Mm-hmm.
as well, and also just to navigate, and when you're the, I mean, when we talk about, you know, medical errors, and this is a very small percentage, it's like,
Mm-hmm.
okay, that's good, but when it's you're the one with the error, you're failing, for you it's 100%, like
Mm-hmm.
that's, you know, it's a
Yeah.
huge problem, because,
Mm-hmm.
you know, and then you have to go and have another painful surgery to remove the
Mm-hmm.
thing and all this sort of thing. And so
Yeah.
it's yeah, now this is something people are very interested in. um Emotionally and supportive wise for you,
Mm-hmm.
how are you still here?
I think it's a realization that happened a lot later, like teenager, because you're in survival mode, living off adrenaline for so many
Right.
years. That I had to get over the anger because I was angry that this happened to my son. How could somebody be brought into, whether it was a religious thing? I don't even know what it was, but I was angry. I was like, how do you bring a little child into this world, a baby, and you make them suffer and go through all this pain? And so I was angry. Like there was, why him? Why us? And but then it turned into why not us? You know, it was this is our chance to make this better. Take our experiences and make sure it doesn't happen to the people coming up behind us, and make sure it doesn't, things don't happen to him again. And that was interesting when you were talking about, so like going back to like the medical error, I would automatically just go, why didn't you sue? Why do you sue somebody when this stuff happens? And I'm like, for what purpose? Like we got to come back here next. We're coming
Right.
back next week for another surgery. Like, what do
Yeah.
you mean? And it's like, then I started realizing there are no outlets for patients. It's either you sue or you file a complaint, which doesn't really go anywhere, and that's it. What else can you do? Um, and it's like, I took a different stand on saying, I need to figure out who's in charge of this process here at the hospital, because I want to work with you to make sure it doesn't happen again. And that has somewhat worked for me. I've been able to advocate and be a part of a lot of different boards and quality projects in many different settings. And that has helped. But it's this, we have to get away from us versus them, more of a partnership. Because as long as I've worked in the medical field now, and I'm like, the providers are just as burnt out and frustrated and angry as the patients at times, right? They didn't get into this field to do a bunch of paperwork. Like the majority of their day is paperwork, and paperwork, yeah, maybe it's necessary. I'm always questioning, why is it necessary? And it's like, no, they're just as frustrated as the patient. Why aren't we joining together for change? You know?
Well, it's funny. That's kind of one of the lessons of that malpractice book that we just put
Mhm.
out. And especially given the fact that the subject in the situation, Dr. Oxbury, he was a neurosurgeon, and he did not go back to neurosurgery after that trial. He went to work for an insurance company approving claims.
Mhm.
And that we've just done some follow-up blog posts about his time there and what's wrong with insurance
Fascinating.
companies and all this
Yep.
stuff. Yeah. And he actually did a response. I had a guy on named Greg Vigdor. We were talking about insurance, and he actually wrote a really
I
great
saw that
article.
one.
Yes, in response to that. Yeah, it's Dr. Oggs. Yeah, we did it to promote his book and
Book I
everything.
saw. Yep.
Yes, yeah, and it's an interesting kind of back and forth on
Yeah.
that whole situation. And so yeah, so I've learned, and all this has happened in like the last year or so, and I have had my own positive and negative experiences. I had an allergist asthma doctor fire me once because I was at home dying and couldn't get his overnight nurse to give me a call back. And when I eventually went to the hospital, again, I'm actively dying. I complained, and it was in a modest sized town, and he was mad at me for complaining because the hospital called him to complain about him not taking care of his patients, so he's fired me as a patient. That's how we solved that problem.
That's just ridiculous. You know?
Yeah, and it was so funny because it never happened to me before, and I had because I was always I was always raised to be the good little patient sort of thing, so I'm always going along to get along sort of thing. And after that, that kind of quickly came to an end for me. Now I show up with paperwork prepared. I Google. I'm worse than a crunchy mom. I Google everything. Like sort of. I mean, Medicare, all this type of and people are amazing. And I love doctor's offices, and I have moved around the country a lot, so I've had to establish care at different places, coast to coast. And I only will stay at offices where they embrace the fact that I come armed with my iPad with all my info ready to go. Like every supplement, every pill, there's just like everything. I come very prepared, knowing what's going on. Yes, this, not all this sort of thing. And if they embrace that, then I stay. If they're threatened by that, I find someone else. Flat out. Like I don't even at 37 years old, I don't play with this anymore, sort of thing. And so it is a very difficult, very difficult thing. So
and that's it. You don't have outlets. Like you sue or you file a complaint, it doesn't go anywhere. It's like, because the healthcare industry, they're not short of patients. Like they don't need your like they need your business somewhat, but there's plenty. They got business. It's not like they're trying to sell you anything.
No, yes. I mean, if you go, there's 10 people waiting outside in the parking lot, Yes.
We're not going to bend over backwards to make sure that you're happy. Yeah. We got more people coming.
Yes. And that also, I mean, and I think I think is part of the kind of in a weird way, kind of part of the problem. There's no way to make these systems any better sort of thing.
Because I think we are confused as to who the customer is in healthcare.
Yeah.
You would assume it's the patient. It isn't.
No.
It's insurance companies more so likely because you have to make them happy or you don't get paid.
Right.
Because unless you're private pay all the time, there's no reason to make like you, the patient, happy because you're not paying for the product, right? So to speak, in their sense. They're having to. So it's like, who's the customer and who do they need to focus their attention on? That's what I always find interesting.
Yes, and I think that's oftentimes health insurance, and that's one of the things about like Greg
Yeah.
Vigdor, is oftentimes the health insurance company, and what the health
Hmm.
insurance companies prioritize gets diagnosed more. I mean, it gets diagnosed, it treated more, it gets resources
Yeah.
devoted to it, all this type of thing, and it's funny because one of the everyone's always trying, how do we, save on healthcare costs and
Hmm.
lower prices and all this sort of thing. And I said one of the advantages of making healthcare, especially doctors, also, doctors especially salaried jobs,
Hmm.
is you end up with less catering to insurance companies. And Dr. Augsbury
Hmm.
was helpful again because he's like, I made less money in my career
Hmm.
because he did workman's comp claims for a long time, and they're
Yeah.
very sensitive about what gets diagnosed, what they
Yeah.
get paid for, all because it goes through the
Hmm.
state and they're cheap. So, sorry,
Right.
yes, right. And so he's like I made less money because I wouldn't always do an operation. He's like a lot of surgeons. That's what what you come in, they evaluate you,
Yeah.
yes, operate, yeah, and it goes on like that. And he
Yes.
said and it's especially true if the insurance companies kind of pay for the operation without a lot of question. These
Yep.
doctors end up doing it, and he's kind of like, yeah, and he's like, and that's why he's like, honestly, it's like I never made as much money as I could have because I did what was appropriate to the patient and their
Hmm.
situation, not what would necessarily fill the coffers of my practice, sort of thing. And I'm kind of like, I think if you put it
Sad.
to doctors, yes,
Hmm.
and I think if you put it to doctors, we'll give you a great salary and no
Hmm.
more billing, blah blah blah. We'll come to you when we need you to do the medical thing, sort of thing.
Yeah.
I think a lot would. I mean, obviously, people like plastic surgeons who are doing seven figures a year wouldn't be too happy. But your run of the mill
Sure.
primary care family MD, I
Hmm.
think would be a lot happier with a system where
Yeah.
they get paid no matter what, and then they can just offer great exemplary care.
Yeah. And they
And
don't have to
that's
see someone every 15 minutes, which is, I don't know, that's impossible.
yeah. No, I was telling someone, I said, as someone who's paid for private doctors and has also been on Medicaid at different points and stages of my
Hmm.
life, I said, the care that you get from a private clinic is so night and day different from
Hmm.
anyone that accepts Medicaid. It's a joke. I mean, it's
Yeah.
just a joke, sort of thing. In fact, I just when I a couple years ago, I switched onto my own insurance and got with a private doctor because my insurance
Hmm.
covers some things, but not much. And so I got with a private clinic and everything. And I just absolutely laughed and I said, I sat with my doctor for 45 minutes the other day talking about stuff, and there was
Hmm.
absolutely no problem with that sort of thing. I
Yeah.
said, it's such a night and day difference
Hmm.
in care. People would
Yeah.
be, it's embarrassing. Really, it's embarrassing.
Hmm.
Um, and that is just so very,
Yeah.
very, very different. So,
I have a huge, I have a huge bias problem with Medicaid. I'll just put that out there.
I've
My
been on
son is on
Medicaid and
Medicaid. My
yeah,
son is on it, and the reimbursement is so low that he
yeah,
can't get care anywhere because you get the reimbursement is so low. Yet we're asking them to take on caring for one of sometimes the most complex of patients.
right.
They get paid nothing, so what do? They don't even accept them as patients. It does
One
such
of
a
yeah.
disservice. Yeah.
No, I've been on Medicaid in two different
Yeah.
states and I was very lucky in Colorado. My
Mhm.
family doctor, who'd been seeing me since I was
Mhm.
5, was part of a big clinic corporation, didn't care. When I moved to Washington
Mhm.
in the Seattle area, I thought I had a job fell through. So I was gigging and got on the state health and everything.
Mhm.
And yeah, I mean, even in a big city,
Yeah.
finding a doctor who will take you all this, everything was very difficult.
Mhm.
I ended up at kind of a catch-all clinic. It was basically a medical clinic that just that's all they did was Medicare, Medicaid people sort of
Yeah.
thing. And they had a couple doctors, a lot of physicians assistants, a lot of nurse practitioners, which
Mhm.
is great. I love a nurse practitioner. Um,
Yeah. Oh yeah.
and yes, and all this sort of thing. And it was like the way they treated you was
Yeah.
tawdry. I got misgendered by the nurse one time. Like, and I had a beard too, and I literally come in, and the nurse practitioner opens the door. She's kind of like, she did literally 2 seconds. You're not a woman. And I'm kind of like, no, you're welcome to check though. Nope, I come fully equipped, sort of thing.
Yeah.
And she's like, that's the third time this has happened this morning. Closes the door, leaves. I was talking to my friends after. I said, here's the sad thing. I'm not trans. That's not
Mhm.
my ministry. I'm in my lane over here. If I were, and I was already having a lot of nervousness about going to a medical doctor, that would have been a
That
horrifically
would fit it.
traumatizing event.
Yep.
I didn't care because I know me, like,
Yeah.
sort of thing. But it's like that would have been incredibly traumatic. I said,
Mhm.
and the fact that this had happened 3 times that day, why is that person still working in this office? Like, even if it is the low cost Medicare, Medicaid catch all for us
Doesn't matter.
poor's clinic, like, why is this person still working? But here's the problem: is the clinic director will come and say, "I'm so understaffed, I have to keep them
Yep.
because I can't find somebody."
That's the
So
way it is everywhere. Yep.
right, we'll yell at them again, but they'll be here
Mhm.
tomorrow morning at 7:30. Sort
Yeah.
of thing. Sort of thing. I mean, yeah, I mean, it's just a terrible
Yeah.
situation. So how did you mentioned you were on a lot? We'll get back to you now. Sorry about that.
I love the conversation. My
Yeah, so
favorite.
you
Yes.
mentioned you got on a lot of different boards and was working
Mhm.
collaboratively with
Yes.
your medical providers and
Mhm.
everything and whatnot. When did you start to feel more confident and get good and kind of figure out how the system started to work?
Um, when things started to happen, when I would make a recommendation or a change, and that change was actually done, was like that got me started. It was like,
Yeah.
oh, I have a say, I have a power. Um, and literally is something so small. It was the the fact that you would redo a waiting room in a clinic without any input from a patient. And you have to think people in the clinic, they don't sit in their waiting rooms. They barely
No.
even, they usually have a back door. They don't even walk through it.
Right.
And to bring in a patient that could say, like, yeah, I come in here with my son and, or people that come in with their wheelchairs. It's like, this setup is ridiculous. And we would make suggestions. And then you actually like redesign the clinic and you go and you saw your suggestions. That's like, oh my gosh, like it actually mattered what I said. And that kind of got the ball rolling, and I started applying for different boards and councils, and yeah, just worked my way through and sharing our story.
No,
Yeah.
absolutely. And that's no, I mean that's amazingly
Mhm.
wonderful and powerful advocacy. And I mean that's a lot to take on while also you still have a mom of a
Yeah.
special needs child,
Yeah.
who's
Hmm.
you know, requiring way more care at higher ages than you were ever thinking was going to be
Hmm.
your thing. And
Yes.
so that's a lot to take on. So
Yeah.
have you slept in 29 years?
No, I
When was the
haven't. I
last
haven't
time you had a
actually.
good night's sleep? Like,
It's yeah, it's much better now, even though I'm getting better. I'm still worried, but he's 23 years old and he went to a group home. And of
yeah,
course, being mom, I moved and now I live just a mile away from the group home because he's not getting far from me. And I can go check on him constantly. But
right.
that was a big decision and that led to kind of that other half of my book talking about long-term care and talking about vulnerable adults and people with disabilities and how horrific the treatment is in long-term care. And then because I never just leave it at that, like, oh, it's just horrible. Me being naive, when he was littler, I was like, well, if he ever needed long-term care, it'll be fixed by the time he needs it. Of course. No, it's not going to happen. But I look and I was like, why is our long-term care like so why is there so much abuse and neglect and maltreatment in these systems? And if you look at the whole system, it's like, yeah, you got to go back. Medicare, Medicaid reimbursements are incredibly low, so in order to get good staff, you're hiring them at sometimes below minimum wage. So in fact, you're asking people that don't have any training, because that's sometimes a lot of times not required. They're getting paid less than working in fast food, and they're having to take care of very complex patients and do things that most people wouldn't do at minimum wage. Like, I'm not going to handle some behavior issues that you're not even skilled or trained to handle. You're handling a lot of let's just say personal hygiene issues, like who.
Hmm.
And so how do they get these staff in And then you have staff, because I've come across many, many, many in my day that are so gifted and just love it. And they were meant to do this type of work and they love it, but they can't do it. They have to work 2 to 3 jobs to make a living. It's
Yeah.
sad. It is really sad, but goes back to how are we reimbursing this type of care? Not very well.
Yeah, yes, and that, and even just, additional funding stuff. It's always
Yeah.
amazing when you find a place with somewhat decently funded care with someone who's
Mhm.
there for a long time, all this
Yeah.
type of thing. My half brother he's nonverbal autistic. He's 10 years older than I am,
Yeah.
and he lives in a lovely group home. Instantly, his mother, my father's second wife, does live like literally on the same road. And my father
What we
lives
do.
across town. So,
That's what
he
we
didn't
do.
get
I'm basically in the bushes of the group home.
yes, yeah, they didn't get too far.
No.
And everything, and it's amazing. He's had the same people go, the same people every day for a long time. But the state of Alabama also like specifically funds that sort of thing additionally, so that you end up with. I mean, and it's always. I mean, and the problem is it's never universal. It's pockets of you got lucky because you found a system that wasn't
Yeah.
falling apart, sort of thing.
Mhm.
And it's something where I don't think, especially people who've never had to deal with these systems, understand how difficult it can be.
Yeah.
Most people don't have the money to care for people like that long term, and so it's really dependent on us, all of us,
Yeah.
to make it
Mhm.
happen. And so um
Yeah.
it's a very
And I
difficult
think
thing.
we don't talk about, there's not a lot of advocacy in those, even what happened during COVID and all those people that died and everything that were in long-term cares. It's like
Yeah.
we still don't talk about it. And it's like I'm trying to figure out, why is it a psychological thing where I don't want to face the fact that I myself might be in a nursing home someday?
Yeah.
Or like what is it that we don't talk about? Because it's sad. It is a group of people that are in those situations. They don't have a voice, and so it's so easy for them to get taken advantage of. It just makes me like sick. Like, but it's like not enough people, because like how advocates work is if it affects you, then you tend to be an advocate. If it doesn't affect you right now, it's like we'll let someone else figure that problem out. And then it's till the day that maybe you end up in a long-term care facility that you're like, well, I wish I would have done something.
Yes. Well, yeah, and it is definitely, and I think the
Yeah.
whole medical system as a whole, I get really frustrated with,
Hmm.
you know, people who have been lucky enough to not need very much medical care in their lives.
Yeah.
Who act like, oh, it's all very simple and there's so much waste and blah blah blah. And I said, I mean, I'm sure if we go look around long enough, we sure can find some
Yeah.
because it's a human institution. We'll find some somewhere.
Hmm.
I said, but I mean, honestly, it's like these systems barely hold together, and one
Hmm.
strong breeze, they'll fall apart. And we got a real picture of that during COVID, and that was more than a strong
Yes.
breeze.
Yeah.
And it is, you know. By the grace of God or whatever you want to call it, that the entire medical system didn't entirely
Yeah.
collapse.
Yeah.
And a lot of people left. A lot of people died, providers, not just
A lot of
patient,
people. Yeah.
died. I mean,
Hmm.
these things come. The cost for these things is steep,
Yeah.
and it's really hard to explain. Yeah, trying to get care for something when in many cases you have doctors that don't even believe your disease exists. Ask
Yeah.
anyone with Lyme disease, fibromyalgia, all
Yeah.
this sort of thing.
Hmm.
Those of us who still are dealing with long COVID, though these
Yeah.
many years later, those of you who don't, my primary care doctor right now does not believe in long COVID, which has caused me to reevaluate if I want to continue at that clinic or not. But
Yeah. Yeah.
we're having a thinky think about that
Yeah.
right now. Um,
Yeah. But
so
that's what's also horrible about this whole
yes,
situation is that you are told, and I also tell people, you got to advocate, you got to speak up. We're asking people to advocate and speak up when they're sick, like they're at the
yes.
worst time of their life, and now we're like, you better get in there and fight. Why?
Right, yeah, no, I mean that's the problem I had with my allergist. Kind of like, I don't
Yeah.
want to fight with your night nurse. I'm literally dying. Like
Yeah.
I could be dead before the night is through.
Hmm.
Sort
Yeah.
of thing. Now I don't really have time to argue with you right now.
Yeah.
Like, sort of thing.
Well, it's like so bad that we even use those, like we use war terms, like we're boots on the ground, like when we talk about nursing and like the ERs, or we're like,
Yes.
you're going into the battle zone, like what?
Yeah.
Why? We even use those terms. Like, it's going to be awful. Like,
No,
just,
and what's
yeah.
what's amazing is when you go to other countries and their systems, they don't work that way,
No,
at all.
no.
And I remember I minorly fell down in the Louvre in Paris, and they were absolutely dumbfounded that I felt no need to go to a hospital or seek medical attention. I'm like,
Oh,
I barely fell, like I didn't even really fall, like sort of
yeah.
thing. And then it was like, oh, I'm like, no, 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 no. I'm just gonna go continue on. I don't need to interact with your medical system thing. So I think, I mean, most people, it's immediately on the stretcher, off the hospital, you get all sort of thing.
Hmm.
And people, are always amazed that we don't rush into the hospital at every bump and bruise and sort of
Hmm.
things. Like, we don't want to deal with these people any more than we absolutely
No,
have
and they don't.
to.
They don't want to deal with us either. Really, so
No,
we're just
no,
like
yeah. So we just kind of,
real emergencies. Yeah.
yeah, we don't bother unless it's really important.
Hmm.
Um, And so, yes, the navigating anything medical is so hard. And so
Yeah.
you're amazing for having done it for this many years and survived
Yeah.
and managed to be an agent of change
Hmm.
along the way. I wish
Yeah.
for a world where you never had to write this book. Sorry. I wish for a
I
world
know.
where you never had to write this book and we never have to have this conversation.
Hmm.
Like where you got all the help you needed, you
Yeah.
never had to write a book. I didn't have to interview you about it. Like,
Everything's fine.
yeah,
Nothing to
and
talk about here.
exactly, because the system actually worked for you and your
Right.
family, and it's always, and the couple, there are times when people come on, we kind of like, I
Mhm.
wish we created a system where you never had to go through this and never had to, and we never had to talk about it. But yes, it is. But I think also one of the things
That,
I would like to see more of is patient advocates in hospitals,
yeah,
whose job it is to go around and make sure
true
things
patient
are
advocates.
yeah,
The
working
reason
as
why I
they're
say
supposed.
that is because like I've come across patient advocates and I've wanted to like be one as a job.
Right.
And then but some places do it a little different, which I'm like, no, we don't do it like that. Don't put it under your risk management department.
Oh
And then
no.
that's what they do. And it's like, no. That means you're just whatever you do to just make the patient happy. Just
Right.
whatever. So they just shut
Yeah.
up and don't sue us. I'm like, no, put it there. Put it somewhere else.
That's not
Just
patient
we
advocacy,
I
that's
know.
lawsuit prevention.
That's what it is. But then they call it a patient representative. Like, are you sure?
Yeah, like no, you're in the lawsuit avoidance department. Let's be honest about your job.
Right.
Like
And they don't really hide it. They're like, here's somebody from Risk who's a patient representative. Cool. That's awesome.
yes. No, 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 that's no, that makes a lot of sense.
Yeah.
But I mean honestly, typical of the American medical system. Like we should have more patient advocacy.
Right.
Yes, we should prevent them from suing
We
us. That would
really
be
need them to
hire 10 people.
zip it.
Like
If we can get people to just shut up.
they're cheaper to pay than the lawyers.
Yeah.
That yes, no, it's a
It's like
quite
stop doing
sad.
yeah. Stop
Yes, it's
doing
quite a
that.
sad
Right.
situation. We're almost at time, and I have a live show in 20 minutes. So the last
Awesome. Well,
question,
okay.
the last question I want to ask you before we do plugs is, if there was one overarching message or idea
Mhm.
from your book, this story, this crazy life that you've lived, what would you tell people?
To speak up, to and not necessarily when you're going through something, like you like get through it. But then afterwards, like advocate for the other people sadly coming up behind you or for yourself if there's another event, but just to keep the conversation going and to learn about the system and say how can we make this better and find people to partner with, not just patients, like partner with the clinics, with the hospitals, um, and say something because things keep happening because we don't necessarily have a strong enough voice in change. So we need more people speak up, call to action, all of those wonderful things.
Yes, absolutely. So,
Mm.
why don't you let us know where we can buy your book and where we can keep up with you online?
So if you go out to my website, www.whocaresbooks, books with an S.com, then there's going to be links to where you can get the book. There's also a tip sheet on how to, like when going into your doctor's office, all the kind of things you should do with documentation. And there's also then my social media links as well on the website.
Wonderful, excellent.
Oh,
Well,
and
this
one
is
last thing
yes,
is that
yeah.
my book is on Amazon, but there's going to be an Audible version coming about the end of May. So if you're
Oh,
an Audible
wonderful.
lover, wait for that.
wait for that. Yes, excellent. Well, thank you so much for coming on the Cameron Journal podcast.
Yeah. Thank you.
That's all for this episode of the Cameron Journal podcast. Thank you so much for listening. Visit us online at CameronJournal.com. We're on Facebook, Twitter, and Instagram, and I love to talk to my followers and listeners, so please feel free to get us on social media at Cameron Cowan on Twitter, and we'll see you next time on the Cameron Journal podcast.